Coming up on Medwatch today, a focus on you, how meditation and mindfulness can be a useful tool for wellness. Clearing up the confusion, advice for car seat safety, what kind you should use, and how to make sure it's installed correctly. Plus, working her way up the ladder, this week's healthcare hero started small and is now a leader in her department. We'll talk about how she got there. Hi there, and thanks for joining us. I'm Julie Musgrave. Within community medical centers, there are endless ways to manage your health. All of them important, but perhaps one of the most useful modes of medication comes from within.
Deep breathing and calculated movement.
All different choices for all of our abilities.
Yoga is a workout.
Warm and relaxed. I'm stretched out.
But it's being used more and more as a tool for overall wellness.
My mind is calmer. I can think better.
It has been shown to be very powerful in terms of allowing, patients with serious illnesses to maintain their equanimity, to stay calm.
Dr. Lori Weichenthal teaches mindfulness classes at UCSF Fresno on the Community Regional Medical Center campus.
Our society has gotten so busy and so crazy, and we have so much distraction that it just adds to our mind's ability to wander. But we're beyond that now. We can take time to just be present, but to not view the mind as a problem, but to go, oh yeah, this is what my mind is doing today.
At its core, mindfulness is just taking some time to focus on your breath. Dr. Weichenthal says research has proven the benefits. Just a few minutes a day can decrease stress, regulate emotions, and also improve focus and attention.
I think in our patient population, because they do tend to be emergent situations, it's not like you're giving them a course. But if you can just tell somebody to get in touch with their breath, you don't have to react to everything. From your first gut instinct, you can take a few breaths and then act in a more skillful way.
Yoga isn't the only way to practice mindfulness, though it certainly worked for Karen Freeman. She started as a means of exercise.
When I feel good physically and I feel stronger, I feel like life is better.
But soon realized it was helping her battle depression as well.
I have been able to gotten a little more level, some situations in my life.
As we develop more and more technology and more medications and more things we can offer patients, I think it's also important to offer patients a tool that they can use for themselves that is about themselves.
Deep breaths, just a few minutes each day. A simple tool for wellness that can be truly tailored to you.
I really like what it's done for me, and so I think if it's good for me, it's good for other people too.
Keep in mind, different methods of meditation work for different people. If sitting still doesn't sound like you, you can also go for a walk or try a few deep breaths while waiting on a red light. Any amount of time can benefit. When you walk into any community medical center facility, you'll notice it's a place where cultures meld together. Everyone needs a safe place for care. Stephanie Bainham has more on how local physicians are making everyone feel at home on a global scale.
Today we're learning about international family medicine physicians, and we're joined by one right now, Dr. Vora. Thanks so much for being here today.
Thank you.
So tell us what you do around the world. It's truly fascinating.
Well, I'm the Director of Global Health here at UCSF Fresno Medical Center, and that's really a project where we really try to build bridges. We are blessed with a diversity of patients as well as a diversity of practitioners, and people have been all over the world in our community. You can see that in our public places. Whenever you go out, you see people from all over the world speaking different languages, and that's something that is entirely true of our healthcare community as well. So what we try to do with our global health program is match up people that have been around the world and are currently doing projects worldwide with the needs of the Central Valley and our patient population, and just trying to support them in whatever cultural practices and traditions they feel most comfortable in. Most people, whenever they enter the healthcare community, they often bring a lot of different stories, a lot of different backgrounds, and I feel like that by embracing that, we're actually strengthening our community, and that really helps us to treat our patients better in a more culturally sensitive way.
So true. And you have been to many different cultures. What makes you passionate about it?
I have. I think I go there to learn for myself foremost. I'm passionate about education, so I really try to find people that are willing to learn and willing to teach, and really team up with them in order to advance medical education. And I've been successful with, and really just very fortunate with projects that are as diverse as going to Haiti for disaster planning and disaster response after an earthquake that they had there.
Right.
I went to Nepal to do pre-hospital care and toxicology training, and more recently I've gone to India to help train emergency medicine doctors, and that's a specialty that's growing in India, and that's where my family is originally from.
Wow.
So that was a really special trip to be able to go back and give something back to that community, and also just to learn about their practices, because a lot of the patients that we have in our community here in Fresno are used to that sort of healthcare environment. And so I feel like it makes me a little bit more of a sensitive physician whenever I know what kind of healthcare environment someone is coming from, so that I can kind of address them at that level.
It's so important, and at the end of the day, that makes healthcare here so much better. And like you said, they're more comfortable with it, and it's just better all around.
It really does. I feel like we have such a diverse population in Fresno, and we have such a diverse practitioner population in the Central Valley, that it's really just a point of pride for us to be able to bridge those communities and really explore all the different ways that people find healing practices and different cultural practices to meet their healthcare needs. And I feel like it's really important because our world is getting smaller and smaller.
Yes.
I feel like I practice international medicine every day in the emergency department, just because I'm treating people from all over the world. They come with different backgrounds, they come with different stories, and I'm able to kind of meet them at their level and also learn about them through that window into their lives.
Well, we're so happy to have you here in the Central Valley, and thanks so much for your time.
Thank you.
Coming up on Medwatch today, if you've avoided getting the flu shot due to an egg allergy, why new research says it's safe for you to go ahead and get vaccinated. And we'll meet this week's healthcare hero, a woman who's built her career at Community over the past 17 years.